Grabs are an attempt by one person to gain control of another. The techniques we train to release from grabs help you remove yourself from the control of another person in a way that minimizes injury to you as well as the person trying to control you. As with all personal safety skills, we begin the escape from the supportive stance. Remember that you and your co-trainer must demonstrate all parts of the technique first so the participants can see the technique before they are asked to do the technique. To demonstrate, Kelly will step toward Desi and grab both of his wrists. At this point, remind the class about the rule of thumb, which is the concept in PMDB that the thumb is the weakest part of the grab and can be used to our advantage. Notice where Kelly's thumbs are, located on the top of Desi's arms, which means that ultimately, Desi will want to bring his arms upward toward the thumbs to release from this grab. The best way for Desi to engage the weight of both his arms and his core is to bring his hands together, clasp them, and pull them up. However, it is important to remember that in real-life situations, the person grabbing you is trying to control you. If she feels you are trying to pull your hands together, she will most likely try to hold them apart. For this reason, in the first step of this maneuver, we instruct participants to push their forearms out, as Desi will now demonstrate. The person trying to control you will think you are trying to get out by pushing outward, so she will try to control you by pushing your arms inward, as Kelly will now demonstrate. This is exactly where you need your arms to go, so you can use her pushing in momentum to bring your arms in, clasp your hands, pull up and release. At this point, there is one change and one adaptation to this technique we would like to discuss in more detail. First, we will discuss the change. In the past, when pulling arms up and out, we described the movement as a rainbow or an arch over your head to turn and get away. This form of the technique was recommended to help prevent users from pulling their hands upward toward their own face and hitting themselves accidentally. The problem with this approach is twofold. First, by using it, you are not engaging your core weight, and second, there's a potential that you may accidentally strike anyone standing behind you. However, if you use the principle of engaging the core, you can see that also bringing the hands and the forearms directly back to the core offers several benefits. This new form engages the core, keeps arms in close where it is more difficult to grab them again, still minimizes the risk of striking yourself while releasing from the grab, and now also prevents you from accidentally striking others who may be near you. Now let's discuss the adaptation that can be used if initial attempts to release from this grab are unsuccessful. The adaptation involves rocking forward in the supportive stance, shifting the balance of the interaction in a way that can briefly weaken the other person's grasp on your arms, allowing you to release from the grab, turn, and go. Let's demonstrate. It is important to instruct participants that this adaptation should only be used when the person grabbing you has physically overpowered you to the point that the standard technique does not work. This adaptation should never be used with people who are physically frail, have problems with balance, or are at a high risk for falls, since the rocking motion may cause a frail person to fall or be injured. When you are training the double wrist grab in class, remember to give the participants the following instruction. All movements should be slow and smooth, with special attention paid to pulling your arms in close to the core once they are released. Grabs should be light, not tight, as not to bruise the arms of your training partner. All techniques start from the position of the supportive stance, and all participants must demonstrate turning and going, since this is the key part of all of our techniques. In summary, to release from a double wrist grab, you use the other person's desire to control you by first pushing out and then using the person's inward momentum to bring your hands together in a clasp. You engage the core by bringing clasped hands and forearms in toward the body. If this does not result in release from the grab, you can rock forward and retry the release. The rock forward adaptation should never be used with patients who are frail, have problems with balance, or a high fall risk. As with all personal safety skills, the key is to turn and exit towards safety as soon as you are released from the grab.